Hi everyone, today I will tell you about health insurance. If you like my video, then please thumbs up and don't forget to subscribe my channel. Let's get started. First we will talk about what is health insurance. Health insurance is a type of insurance that helps cover the cost of an insured person's medical and surgical expenses. Insurers use the term provider to describe a clinic, hospital, doctor, laboratory, healthcare practitioner, or pharmacy that provides treatment for an individual's condition. The insured is the owner of the health insurance policy or the person with the health insurance coverage. Either depending on the type of health insurance coverage a person has, the insured pays costs out of pocket and receives reimbursement, or the insurer makes payments directly to the provider. In countries without universal healthcare coverage, such as the United States, health insurance is commonly included in employer benefit packages. Next we will discuss about the types. There are two main types of health insurance, private and public, or government. There are also a few other, more specific types. Private health insurance. The Centers for Disease Control and Prevention, CDC, say that the U.S. healthcare system relies heavily on private health insurance. In the National Health Interview Survey, researchers found that 63.7% of people under the age of 65 years in the U.S. have a type of private health insurance coverage. Public or government health insurance. With this type of insurance, the state subsidizes healthcare in exchange for a premium. Medicare, Medicaid, the Veterans Health Administration, and the Indian Health Service are examples of public health insurance in the U.S. Now we will talk about some other types. Some people may also define an insurer by the way it administers its plans and connects with providers. Here is the examples of the types of plan available. In May 2011, just over 200 million Americans have health insurance coverage from commercial or private market health insurance. Over the past 30 years, the financial and legal structure of such insurance has varied. No one model has dictated the market, although there are strong trends from the original indemnity or fee-for-service approach of 25 years ago, to HMOs, health maintenance organizations, in the 1990s, to preferred provider organizations, PPOs, in the past 10 years. The specific terms and structures can be confusing, both to policymakers and to employers and enrollees. The summary definitions below were compiled and promulgated by the United States Department of Labor. NCSL has added notations in selected cases, with source footnotes. The other example is the Federal Health Reform Law. The Affordable Care Act of 2010, ACA, has numerous provisions that affect the structure and extent of health insurance coverage. The Act states that the Secretary of Health and Human Services shall define the essential health benefits for certain health plans. The Act further instructs the Secretary to ensure that the scope of the essential health benefits is equal to the scope of benefits provided under a typical employer plan. The Act requires the Secretary of Labor to conduct a survey of employer-sponsored coverage to determine the benefits typically covered by employers, and to report the results of the survey to the Secretary of Health and Human Services. Managed care plans. With this type of plan, the insurer will have contracts with a network of providers to provide lower-cost medical care to its policyholders. There will be penalties and additional costs added to out-of-network hospitals and clinics, but they will provide some treatment. The more expensive the policy, the more flexible it is likely to be with the network of hospitals. Indemnity or fee-for-service plans. A fee-for-service plan covers treatment equally among all providers, allowing the insured to choose their preferred place of treatment. The insurer will typically pay 80% of costs on an indemnity plan, while the individual pays the remaining costs as a co-insurance. Health maintenance organization plans. These are organizations that provide medical care directly to the insured. The policy will usually have a dedicated primary care physician who will coordinate all necessary care. Health Maintenance Organization, HMO, plans will usually only fund treatment referred by a family doctor and will have negotiated fees for each medical service to minimize costs. This is usually the cheapest type of plan. Preferred Provider Organization Plans. A Preferred Provider Organization, PPO, plan is similar to an indemnity plan in that it allows the insured to visit any doctor they prefer. The PPO plan also has a network of approved providers with which it has negotiated costs. The insurer will pay less for treatment with out-of-network providers. However, people with a PPO plan can self-refer to specialists without having to visit a primary care physician. Point-of-service plans. A point-of-service plan functions as a combination of an HMO plan and a PPO plan. The insured can choose between coordinating all treatment through a primary care physician, receiving treatment within the insurer's provider network, and using non-network providers. The type of plan they have will dictate the progress of treatment. Why is the type of insurance plan important? The type of plan a person has dictates how they will approach getting the treatment they need and how much money they will need to pay on the day they receive it. In 2003, the U.S. Congress introduced a new option, the Health Savings Account, HSA. It is a combination of an HMO plan, a PPO plan, an indemnity plan, and a savings account with tax benefits. However, in plan year 2020, a policyholder must pair this type with an existing health plan that has a deductible of over $1,400 for individuals or $2,800 for families. HSAs can top up coverage, extending existing plans to cover a wider range of treatments. If an employer pays for an HSA on behalf of their employees, the payments are tax-free. An individual can build up funds in the HSA while they are healthy and save for instances of poor health later in life. However, people with chronic conditions, such as diabetes, might not be able to save a large amount in their HSA, as they regularly have to pay high medical costs for the management of their health concern. These plans often carry very high deductibles, meaning that although premiums can be lower, people often end up paying the full expenses of any required medical treatment. There is more overlap as plan types evolve. The distinctions between policy types are becoming more and more blurred. The majority of indemnity plans use managed care techniques to control costs and ensure that there are enough resources to pay for appropriate care. Similarly, many managed care plans have adopted some characteristics of fee-for-service plans. This concluded that health insurance helps covers the cost of an insured individual's medical and surgical expenses. There are various plan types, and they vary in terms of what they cover and how a person can access treatment. Currently, a person in the U.S. must have some form of health insurance coverage. Anyone without a form of coverage may need to pay a fine.